Hello, I'm Dan. I'm going to talk about non-English speaking population health concerns. Most people know that the non-English speaking population in the US is increasing and the trend is 50 years old. Effective and meaningful communication is essential to success of the public health. Limited English proficient citizens would have trouble getting access to clinical services and healthcare. That's why it makes this population vulnerable for increased health disparity. According to the survey in 2017, more than 62 million people doesn't speak English at home in the US, according for 20%. In Utah, about 14% residents don't speak English at home, which is below the national average. It's probably because of the smaller immigration population. What could present a barrier for this population? The biggest one is communication barrier caused by limited English proficiency, which mainly involves four aspects. First, the economic stability. Citizens with limited English proficiency hardly get well-paid jobs, which affects their economic stability. Second, education. Limited literature leads to low health literature, so this population is not very health conscious. Third, different languages have different cultures, which cause discrimination and affects the social coherence. Fourth, health and health care. They are rarely aware of the importance of health care, and sometimes they have problems with access to health service and insurance. Their specific concerns involve three aspects. The physical concerns include adverse medical outcomes, poor compliance with therapy, and poor understanding of medical conditions. The psychosocial concern is that they have substantial barriers to the language and culture of mainstream society, even experience linguistic isolation. All of these concerns would lead to the emotional concern, that is to say, the depression. Why is this population vulnerable? Because they can't get fully access to the benefits of healthcare service. Because the poor quality of care and services offered by healthcare professionals. Because caring for non-English speaking patients was more challenging. It took more time and impacted nurse productivity. Because they have communication problems in healthcare settings, which were attributed to the language and cultural barriers. Based on Maslow's hierarchy of needs, as for the majority individuals in this population, the physiologic needs have been met. However, the safety, belonging, esteem, and self-actualization needs haven't been met. According to this evaluation, the overall anticipated functional level of this population is to meet their safety and belonging needs by addressing the communication issues. It means the likely health outcome is to get access to health equality. If health providers can overcome barriers and challenges such as advocating and negotiating for the patient's needs, it will improve quality of care and reduce health disparities. I haven't found any evidence supporting that this population is at a higher risk for communicable diseases and infections as compared to the general population. However, this population is at a higher risk for non-communicable diseases, especially for chronic disease, activity limitation, and depression. It's mainly because they have a lower health literacy and poor access to disease prevention information. To prevent and manage these conditions, we should develop barrier-free and inclusive non-communicable disease and diabetes prevention strategies. Health professionals should pay attention to better understand the specific needs of this population and sorry, improve coordination skills or culturally conscious care. It's also important to have resources readily available, such as interpreters for nurses, when providing care for this population. They are also at a higher risk for self-care deficits, because poor self-rated health is more prevalent among this population. Health providers should offer some self-care education and increase their self-care awareness, providing ethnic and language concordant health care. Furthermore, developing their ability to understand written information or ensuring that health education materials are comprehensible for them may improve self-rated health status. Health professionals should develop culturally appropriate programs to address both verbal and written communication. Training community members who share the same language background to deliver carefully designed health message or information can effectively promote both chronic disease management and cancer screening. This population is at a higher risk of being harmed by others. There is a potential harm to them when doctors make critical mistakes and diagnostic errors. This harm could be mitigated by hiring a staff fluent in a second or third language and ensuring that interpreters are available when they are needed. They are my references. Thank you for listening.